Good evening, and thank you for joining us here on blackdoctor.org for tonight's program, which I am very, very excited about. Y'all just don't understand. These are the type of programs that I love to do here, and so I'm going to get right through it. So, a couple things we're going to get to. We got a wonderful program with some very, very special guests, very accomplished, and we're going to answer your questions. So, there's a couple things that I need you to do for me. First, I need you to let us know where you're watching from. So, if you want to type that in the comments, we'd like to know where people are watching us from all over the world, and we'll give you a shout out and your city. So, rep your city here on blackdoctor.org. Number two, if you know somebody that needs this information, please share it on your page. Please tag them and let them know, hey, there's a great program going on right now. I thought about you. You need to get this. You need to answer these questions. They got some great doctors on there. And then finally, if you have any questions for our guests, please drop those in the comments and we will get them asked and answered because this program is all about you. So I don't know how many people wear contact lenses. I just know there are a lot of people that wear contact lenses, right? In my own household, my wife wears contact lenses, right? So our lives are touched by contact lenses on a daily basis. And so we thought as our ongoing partnership with the CVEA and the National Eye Institute that we wanted to have a show about contact lenses, about something that people do every single day, put those contacts on and off. Now, there's some good things about contacts, especially in terms of correcting your vision and allowing people to be able to see and function at a near 20/20 level or beyond a better level. There's some bad things about, and the bad things is maybe about some of the ways y'all have been wearing these contact lenses. Some of y'all remember wearing them too long, getting to dry, not taking care of them like you're supposed to. There's some bad things that we're going to help you correct. And then there's a couple of ugly things that can lead to more serious condition. If we continue in the bad, then we can get to the ugly. But we're going to talk about the good mainly tonight, talk about what contact lenses are, how they function, what you should be doing, and how you should be handling them if you're wearing contact lenses. And we'll also talk about what it means to, when you think you might need some contact lenses, when you get closer, or for your kids, if they might need some contact lenses, we've got two great experts here to let you know the real deal. So I'm going to introduce our guests this evening. First up, we have Dr. Jeffrey Coffey. I'm hoping I'm pronouncing that right.
Yeah,
and he's a board certified optometrist with a keen interest in the treatment and management of ocular disease. He is originally from Charlotte, North Carolina. Shout out to Queen City. And after graduating from East Carolina University, he went on to earn his doctorate at the Pennsylvania College of Optometry, where he was inducted into the Beta Sigma Kappa Optometric Honor Society. He's got a bunch of other stuff. He's on that board for blink of time. I can't put it all in there, but he's a bad man, ladies and gentlemen. And our next guest is Dr. Michael Coleman, and he is a board certified ophthalmologist. And he went on to complete his residency. He graduated from the University of Texas Southwestern Medical School and went on to complete his residency training in ophthalmology at the esteemed Kriegs. I don't know how to say that. I got a Southern tongue, Dr. Coleman. Eye Institute in Michigan, and Dr. Coleman's subspecialty training was completed at the internationally renowned Wilmer Eye Institute at the Johns Hopkins Hospital in Baltimore, Maryland. Dr. Coleman is a highly skilled and experienced surgeon specializing in laser vision correction, also known as LASIK, refractive cataract surgery, corneal transplantation, glaucoma surgery, and complex cardiac removal. So, gentlemen, welcome to the program.
Kresge.
Thanks for having us.
Thank you for having me.
So we'll start with you, Dr. Coleman. Can you kind of give a brief anatomy and overview of the eye? And more importantly, where does the contact lens actually supposed to go on the eye?
So if you're looking at someone directly in the face and you're looking at the eyelid, what you'll see is the skin of the eyelid first, then you'll see the eyelashes, and you can kind of see where the natural skin transitions to that wet part of the eye. The wet or moist part of the eye is called the conjunctiva. So the whole backside of the eyelid is covered by conjunctiva. And then there's the moist surface that sits on the eye, also called the conjunctiva. So the conjunctiva on the backside of the eyelid and the conjunctiva from the eye, they actually meet kind of in a crevice toward the bottom of the lower eyelid and the top of the upper eyelid, and that's called the fornix. And that creates a little pocket that sits in front of the eye. The contact sits in that pocket. the reason that this is important to know is that that pocket is sealed. So sometimes patients are asked and they're concerned that their contact lens could move and potentially go behind the eye. That is of no concern because that pocket is perfectly suited for contact.
Okay, see, I didn't know that. I just thought you just put it on the eye and it just stayed there. Okay, so there's a pocket that the lens actually goes on. So, Dr. Kofi, what are some examples of how someone can benefit from contact lenses versus your traditional glasses?
Well, contacts correct both nearsightedness as well as farsightedness. And in some patients, especially those over the age of 40, it can benefit them by also giving them near vision so that they don't have to wear their readers or depend on their readers as much. There's also a cosmetic advantage to contacts in that, patients not only want to see their best, but also look their best. And in addition to all that, it's great functionality, especially for patients that are practice sports. If they do something like basketball or football, they don't have to depend as much on their glasses. So contacts have a whole range of functionality. And, I know we're going to dive into that a little deeper in today's discussion.
Absolutely.
Yeah.
Okay. So Dr. Coleman, what are some more complex uses for contact lenses?
So as Dr. Kofi was saying, obviously there's kind of routine vision correction. So for more complex diseases, so sometimes the cornea, which is the window into the eye, is not the appropriate shape for optimal focusing of the eye. And so in patients who have that particular issue, we have rigid gas permeables, hybrid contact lenses, or sclerals, and those sit on the cornea and they kind of can mask or smooth out that irregular surface. So a disease that people may have heard of is keratoconus, where the cornea is very irregular and you can put a hard contact in. They also have these tissue contacts that are made out of amniotic membranes. An amniotic membrane is from the placental tissue, and it has some pro-healing qualities, some anti-inflammatory qualities. And so there are some people who have severe eye inflammation, or sometimes it's chemical burns or other injuries, where we put that type of contact on the surface of the eye. I think as it relates to, and this is not necessarily vision correction, but also people who have normal corneas but a lot of astigmatism, sometimes you can use one of those rigid gas permeables or hard contacts for those as well.
Absolutely.
All right, so Dr. Kofi, I know there's people try to do a lot of different things with their contacts, right?
Mhm.
So what are some things that people should not be doing with their contacts or in their contacts?
That's a great question. So I always educate patients to refrain from the 3 S's, which are sleeping in their lenses, especially overnight, showering in their lenses, and swimming in their contact lenses. This could be extended to patients being in like the hot tub, or, for instance, doing using like tap water to clean their lenses. There's disinfectant multi-purpose solutions, as well as hydrogen peroxide solutions that can be used to clean the lenses thoroughly and effectively. One thing I wanted to elaborate on is that there are a whole range of contacts, as Dr. Coleman was talking about. But in the soft contact lens realm, some of the most widely available are either going to be daily disposable lenses, bi-weekly lenses that last up to 2 weeks, and then monthly lenses that are usually good for up to 30 days. And so another thing I always educate patients about is trying to stick to a rigid schedule so that they're not over wearing their contacts or trying to stretch them out. For instance, take a bi-weekly lens and then using that up for 30 days, because that can also lead to infection over time. So now another thing patients sometimes do is use hand sanitizer prior to putting in their contacts, thinking that that is an effective way of cleaning their hands. But we all know that alcohol being applied to the eye can also sting a lot, right? So I always encourage patients to wash their hands with classic soap and water and give that a good solid rinse, and then drying their hands with a lint-free towel before inserting or removing their lenses.
So Dr. Coleman, so I like that. The three S's, that's something that's very, very simple. Don't sleep, shower, or swim. What are some of the reasons why people should not be doing those three S's? Because I know you're a surgeon, so you get it. You help correct when people have some serious problems with their eyes. So what can happen if they do those three S's while wearing their contact lenses?
So first off, the three S's is amazing. I agree. That's a nice, simple way to remember it. So about 45 million people wear soft contact lenses in the US. So they're very successful, they work great, but the biggest risk factor for corneal infection is soft contact lens wear. So those three S's are very important to avoid because you can get severe, significant infection of the cornea, which can cause sometimes loss of the eye, but severe vision loss and loss of function. So you take an eye that's working well and seeing well to an eye that doesn't contribute to any useful vision. And bacterial infections are the most common with contact lens wear is Pseudomonas. But if you think of the contact like a sponge, that sponge is absorbing everything, which is why it's very important to use those disinfectant solutions. But if you're not cleaning your contacts or you're sleeping in them a long time, you have basically an absorbent sponge that can have bacteria in it sitting nice and on the surface of the cornea. And if the cornea is getting injured from overwear of your contacts, then that predisposes you to have corneal infection. Another thing is the contact, although they do allow good oxygenation of the cornea, you do want to give your cornea some rest because you can end up having essentially your cornea become hypoxic or is asking for oxygen, and that can lead to neovascularization and scarring of the cornea. And in some people in severe diseases, it can cause what we call a stem cell deficiency, which causes the cornea to go from nice and transparent to an opaque, cloudy color. But both of those are very significant and cause long-term disability.
Wow. Okay. So, you said 45 million people. That's a significant amount of the population. So we're talking about a country where you have about 300, and I think we have about 330 to 350 million people living in this country. 45 million is a significant amount of that population that are wearing soft contact lenses. And we know that sleep has to happen all the time. Hopefully showering has happened on a regular basis. And swimming does happen on a regular basis, especially in the warmer parts of the country. And even in the colder parts of the country, they have indoor swimming pools. So those things are happening. And with those illnesses those potential illnesses that you're talking about, we do have to take better care with regards to how we're handling our contacts, how we're not trying to stretch them out, as Dr. Coffey said. Don't try to stretch it out beyond the limits of what they can do or what they're prescribed to do, because they were prescribed for 2 weeks. If you try to stretch them out like that, you're misusing things. It's like that date on the milk. Okay, you can drink it. You can drink it after the date, but they can't be held responsible for what happens to your body if you drink that milk after the date on the carton. So, Dr. Kofi, how does somebody get contact lenses? They come to see you, and you have a consultation. You say, okay, they're not seeing. I don't even know what the number is. Where somebody is it 20/60? Is it 20/40? When you start thinking they might need some corrective spaces, what's that process like? What's that process like for somebody to get prescribed contact lenses?
So patients usually come in for a comprehensive eye exam where we not only look at their eyeglasses prescription, but more thoroughly investigate their eye health and educate them about things like, cataracts or glaucoma. But if the patient is motivated to wear contacts, we dive into those topics, and I help them to select the best option for their lifestyle or their needs. And, mainly patients can order contacts through our practice or through, their local eye care provider. They can also order them online as well. And we all know that this is a possibility, but there are definitely advantages towards ordering their contacts through their local eye care provider, because we know that the lenses can be shipped directly to the practice, and therefore as the doctor, I can ensure that the prescription's accurate, that the patient's happy, and we can troubleshoot the issues on the spot, just to make sure that the patient is completely satisfied. And if there is an issue with their order, again, because they're going through a doctor's office, we can assess and correct and make sure that the patient is truly happy. Um, on the other hand, like I said, patients can order their contacts online. This has its pros and cons, but one thing I want patients to be fully aware of is that there are hidden fees that are baked into the prices of most online retailers. So, although it might look discounted at the initial checkout, once those hidden fees start to pile up, patients might get a little surprised. Versus going through their local eye care provider, they can use their vision insurance to receive a credit towards their contacts. And a lot of industry manufacturers of the contact lens brands, the major popular ones, have great rebate incentives that are exclusive to eye care providers. So patients really do have more advantages going through their local eye care doctor versus ordering online.
So I got a question. As a follow up, can somebody go straight from not wearing glasses? Can they bypass the glasses and go directly to contact lenses, or do you recommend them having that, at least wear glasses for a period of time once it's been determined that they need glasses before they make that jump to contact lenses?
That's a great question. I usually allow patients to wear the glasses first, and then after, let's say a month or possibly less, just making sure that they're happy with how the prescription is, making sure they can
Right.
adapt to it well. Because with contacts, that's the next step where we have to spend some extra time training the patient to safely handle their lens, how to care for their lenses, and
Right.
insert and remove them. So we want to make sure that they're satisfied with the prescription before we jump into put it on the contacts.
And for a new contact wear, what would you recommend? The daily wear, the monthly wear, the biweekly? What would you recommend for somebody that's just starting out with contact lenses?
That's another great question. Each lens has its pros and cons, right? So
Mhm.
with the daily lenses, they tend to be the most comfortable, but they're also slightly thinner. So it could be a little more difficult for a beginner to get the grasp on how to properly insert and remove their lenses. On the other hand, monthly lenses tend to be great because they're cost effective and they're a
Mhm.
little easier to train on. I found personally that the best happy medium is going with the biweekly option because it kind of gives the best of both worlds, where it's nice and comfortable, but it's a 2 week schedule, and so patients can be able to follow on that. Then from there, depending on what the patient's needs are, again we can either go to a monthly, but more than likely dailies have been the most popular at our practice.
And if you're just joining us, we are talking to Dr. Michael Coleman and Dr. Jeffrey Coffey about contact lenses. We're talking about the good, the bad, and ugly of wearing contact lenses. So what is the normal age that you could say somebody could start wearing contact lenses? Is it 8, 9? Is it determined by the maturity level of the child? Like what is that point where you say, okay, this person can wear contacts?
Yeah, another great question. The youngest I've ever fit was a 7-year-old,
Okay.
but sure, that's based on how the parents feel about as far as their child being mature enough and responsible enough to care for their contact lenses.
Mhm.
But contact lenses, I feel like any age, any demographic, as long as they're motivated, they have healthy eyes from the start, and they have the maturity or responsibility. Like, if some people tell me that they might not feel good about touching their eyes, so I know that for once they're not the best candidate. But if someone has good hygiene and like like I said, if they're motivated, we can certainly start them on that program. And 7 and up, I think, is a pretty good route.
It sounds like discipline is kind of a good barometer for someone to wear contacts, because you have to be disciplined to take them out, because there's that one S about sleeping in your contacts. So you have to have good discipline to take them out, and good discipline to keep them clean and not do those shortcuts that many of us do when we're trying to, because when you wear glasses, there's a lot of shirt tails that have cleaned up our glasses. And that's not that big of as big of an issue, because it doesn't really come in contact with the eye as much as a contact does, and doesn't sit on your eye like contacts. So speaking of which, Dr. Coleman, when somebody doesn't have good fitting contacts, what are some of the complications that can arise if their contacts aren't fitted properly?
Well, so I think from a comfort standpoint, it's a lot harder for people who have just been put in contacts, so they don't know what a contact should feel like. Before a more experienced wearer, I think the biggest thing is your contacts feel different, right? You know how they should fit. So if you identify that something's odd, don't just kind of push through it because you want to, right? Like that's something that should be looked at. With that being said, poor fitting contacts can cause lots of problems. They can cause, as we mentioned earlier, not having a contact that moves well can cause a cornea to get an inability to get oxygen from the tears, and that can cause your cornea to start swelling, which will make your vision poor. It can end up with vessels growing into the cornea. It can lead to scarring. You can have a lot of discomfort. Patients will say the eyes are kind of persistently burning or gritty, like you have sand in the eye. And that poor fit, not only will it make your comfort poor long term, it can cause a lot of permanent vision loss. So if your contact is feeling like it's not fitting right, feel like there's something under it, a lot of patients will think their contacts are torn, right? These things are things you need to take it out. If after putting them back in they don't fit right, go back to your eye care provider so they can look at you, make sure that it's moving right, it's fitting right, and that way you can have a great experience.
So we got an excellent comment from one of our viewers, Lynn. She said, "Ever have a lens get lost in your eye? What happens when somebody gets that lens lost in the eye and they start having that panic? What should they do when that lens slips up in that upper eye?"
Well, so as we mentioned in kind of at the beginning about the anatomy, so it doesn't get behind the eye. So there's no concern that it's behind the eye, but they can for sure be folded under the eyelid. I've pulled out 4 in one patient before. And so if that happens, I mean, first thing I would do is see if you can kind of feel it with the eyelid and you want to try to push it down. So look down, push it down and open your eyelid to be able to grab it. If you can't get it within, like, I'd say 24 hours, then you need to have someone at the eye doctor take it out. This is actually a much more common problem where you can't get your contact out with some of the bigger contacts like scleral contacts. Occasionally you have patients come in and the contact is actually suction cups onto the eye. And I've had people panic and go to the ER because they're worried they're going to lose their eye. Again, just go see your eye care provider. We can get it out for you. And again, check the fit. Because again, we don't want you thinking that this is going to be a traumatic experience. We want you to have a good experience with your contact.
Absolutely.
Here's another great comment here from Grits and Bits Jules. She says, "My son was wearing contact lenses from the age of 4 months. He was born with cataract and now has glaucoma. He now wears glasses. She was trained to put them into his eyes, and he wore them until he was 5 years old. And because he was losing it so often, he started wearing glasses." So that seems like an unusual case where a child is wearing contacts from 4 months.
So obviously with congenital cataracts or cataracts that you're born with, those are very urgent to take out. And when babies are really, really young, they don't always put implants on the inside of the eye. And so in order for them to develop normal vision, you have to correct their eyes. And it's really hard to put a toddler in some glasses. And so in those cases, or babies, it's just more effective to have the parent trained to put the contact lenses in until they can get older. We also put implants in once the kids get older. So you can have let's say a 2-year-old or a 5-year-old. We can actually take them to surgery to put an implant in to correct a lot of the prescription that they have left as a consequence of either having cataract surgery or sometimes having really, really long nearsighted eyes. But I would say that is not as common, but if it happens, we also have ways to address that as well.
So, Dr. Comfrey, talk to me about dry eyes. How do, I get that question a lot. We get that question a lot when we've done these other programs and we talk about dry eyes. So, what are dry eyes? And what are some ways that people can correct having dry eyes?
Okay, so dry eyes is basically an umbrella term of any host of issues that can lead to discomfort with the patient's vision, stinging, burning, grittiness sensation, red eyes. There's a lot of things, a lot of symptoms that we address overall as dry eyes. But for these patients, they could still be a good contact lens candidate. We just have to consider, that we're making them comfortable. And the best recommendation I have for those patients is using daily disposable lenses. That way, they're using a fresh lens every single time they actually want to wear contacts. One disadvantage, I would say, to like a monthly lens is over a course of time, the contact lens material can start to degrade, and it can carry with it proteins or little like lipid deposits, for instance, that over the course of time can build up on the lens and make it a little bit more of an uncomfortable experience. So daily disposable lenses are the best suited for dry eye patients. There's also re-wetting drops that can be used with or without contacts on. So I encourage those patients to use those tools as well. But I certainly don't think that, again, depending on the severity of the patient's dry eyes, that, it could be a limitation. There still are solutions for patients who want to wear contacts, but they have dry eye issues.
So, what, and I had this, I'm going to get a little personal because I deal with allergies on a regular basis. And when I was going to get my eye exam, my optometrist told me that I had some minor scratching on my eyes because I rubbed a lot, right? What can we do to avoid that rubbing? Because even now, like, it's especially, living in Georgia, the allergy season here gets really, really rough. There's a lot of pollen. And so there's watering, and then I just get really itchy from the pollen in the air. So how does somebody that has allergies, that rubs their eyes a lot, how do they get over that so they don't, potentially, damage their eyes by the constant rubbing?
So I would say, go ahead, Dr. Cole.
No,
I was just gonna.
Well, one other thing that you touched on earlier, Dr. Coleman, is the patients giving themselves an occasional break here and there. So maybe, if they're wearing the contacts 5 days on, maybe 2 days off out of the week, that will give them a little break in between. But there's topical antihistamine drops that can be used. And so I encourage patients to use that before they put their contacts in, at least maybe, they put the drop in, they give it about a 10-minute window before they put in their contacts. And those topical antihistamines, they help to cure itchiness or, at least make the patient feel a lot more comfortable throughout their contact lens wearing experience. But please go ahead, Dr. Coleman.
So I agree. I was just gonna say, if you have allergies, effectively controlling your allergies in general, right? That means if you're having sinus, drainage, pressure, right? The eye itching is just another manifestation of poor allergy control. So if you're having a lot of seasonal flares, then the priority would be to get your general allergies under control, because that'll go a long way in improving the surface and the allergies and the scratching and stuff like that. The topical antihistamines work great. You don't want to be rubbing because, again, you can irritate the eye, you can actually distort your contacts a fair amount too if you're like super aggressive. And long term, you stretch the eyelids, which may make it hard for you to keep the contact in the eye long term. So just get your allergies under control. Use topical antihistamines as your doctor prescribed, and then use a rewetting drops like Dr. Kofi had mentioned.
Perfect.
There's a good question coming in from the comments. This is from Jules, and she's saying, "I wear the Boston lenses." Y'all from, do you know what she means when she's saying that? Because I don't want to.
So RGP.
Because she's asking how often should she replace them. She says right now she gets a new pair annually, but she also has dry eyes and a retina eye disease, so she's got a lot going on. right there. So, Jules, at this point, there's a lot that probably would entail. Yes, she said yes. She has hard lenses.
So I mean, I think so. I don't know what specific lens she has, but hard contacts last somewhere between 1 to 3. I mean, if you're amazing with hygiene, maybe you can get another year out of it. But I mean, essentially for the hard contacts, you just need to make sure they're not scratched, they're not chipped. So just making sure they get inspected. I don't know what your follow up with your eye doctor is, but they should be periodically having you come in to make sure the contacts are sitting well, and also just get a good look at them. Because if they get chipped, then obviously it'll cause some eye problems. So I would say just keep your eye appointments. I wouldn't try to stretch it too much, because if you've been having good experience at yearly replacements, that means that cycle is probably working well for you.
That's good. That's fantastic. Yeah. So how often? So Dr. Jeffrey, how often should they go if they have something like that where they could go multiple years? You have contacts. How often should they see? Get an updated eye exam.
That's a great question. Whether the lenses are soft or hard, the recommendation is at least once a year. So contact lens prescriptions are only good for 1 year out from the day of the prescription. But as Dr. Coleman was saying, the hard contact lenses can be stretched out. Like I've seen, at least 3, even 4 years with excellent hygiene, maintenance by the patient. And the thing is, when it comes to contacts, we just want to make sure that our patients are having comfortable, enjoyable experiences with their lenses. So they're always encouraged to follow up if they're noticing that something's off with their vision, if they're having any redness, if they're having any eye pain or soreness or anything of that type. We always encourage patients to come in sooner. But otherwise, 1 year would be the recommended guideline for the patients following up.
So is that with the full dilation, or is that just a regular? Because I told you, we do that series with Dr. Coney, and he's like, and a full eye exam with the dilation is where you really get the understanding of what's going on with the person's eyes. But a yearly checkup could just, what is that in terms of that annual checkup?
Okay, so we're not only checking the patient's vision and prescribing glasses if those are needed, as well as contacts if the patient wants that. But we're also checking their eye pressure, and we're assessing their pupils, where we're looking for neurological conditions, as well as making sure they don't have other diseases like glaucoma or macular degeneration. And then when we're reviewing things with the patient, we want to make sure they have a full understanding of everything going on with their eyes, so that they can make informed decisions about how they want to proceed with, whether it's glasses, contacts, or even something like cataract surgery. So we try to make it as comprehensive as possible, just so the patients feel empowered to not only see their best, but also feel their best too.
And I like to add on to Dr. Kofi's answer.
Sure.
So as part of that exam, we're talking about, since it's a contact lens discussion, some of those more subtle findings that suggest that maybe you're not wearing the contacts the way that you're supposed to be, like that'll be our opportunity to really discuss how your schedule is going, and then let you know that, hey, maybe we should switch the contacts. We see some findings here, so that's an opportunity to check in to make sure that you're doing well, but also that the eye health is maintaining itself.
Fantastic. Well, you all are touching some nerves because there's some questions that are coming in. So we've got a good question coming from Julia, and my wife has the same issue where the contact lens for the left eye and right eye are different. Right, the prescription is different. It's just a little off, but it's not the same. So you have to get the two boxes, one for the left and one for the right. But the question is, because how some folks are. She's asking, are there serious consequences to continuing to wear the same prescription in both eyes, even though you have a different prescription? Are there going to be some consequences by continuing to wear the same prescription in both eyes, just to save the money from having to buy separate lenses?
That's a good one. Yeah. Well, it depends. So, what I'll talk about is there is one, I guess, setup for contacts that can be used to fix an issue called presbyopia. Presbyopia is basically somewhere over the age of 40. Sometimes it's like 45. Sometimes it's even the age of 50 but eventually everybody over the age of 50 is going to notice that they're having issues with seeing things up close. So one setup that eye doctors commonly perform is monovision, where we have one eye distance, which is their dominant eye, and then one eye for reading, which is their near eye. And the goal of that is to help the patient have the best functionality of their vision without necessarily having to depend on their reading glasses as much. So, I've done a lot of monovision over the years. There's better technologies out there, such as multifocal contacts that kind of give you the best range of vision, where you're at distance or you're up close trying to look at your cell phone. But each patient's a little different. And that's why I said it's kind of guided based on, what exactly their lifestyle is and what they're looking for. But Dr. Coleman, feel free to jump in.
Well, I think so. The question's phrased from a harm standpoint. There's no harm that's going to be done, but so to some degree, that difference could change over time and maybe become a little bit bigger, such that the quality in the one eye is not the same. I think if you think the quality is the same, then that's an easy decision. But some patients are a lot more particular about that, and so you want to make sure, from the doctor's perspective, that you're giving the patients that both contacts. And some people are a little bit pickier about the edges of their vision, but it's not going to cause any harm to you, just wearing both eyes. I would say about the monovision, it's just a great option. It can really delay the need for reading glasses, and for some people who can tolerate a big gap, completely eliminate the need for it. And sometimes the doctor is trying to kind of beat you to that complaint. Some of the stuff will be subtle that you mentioned about, not being able to see stuff as close, as clearly close up as you used to, and they can give you a little bit of near help so that you're not needing to reach for reading glasses early. And then you don't have to wear reading glasses. You have to be concerned about a doctor prescribing you reading glasses because they've already fixed it for you.
Perfect.
That's fantastic. Okay. So this is an interesting question. Can you still wear contact lenses if you've had a toric? I don't know if she's saying that right. Implant. Is she saying that correct? Is there something called
Yes.
a toric implant? Okay.
Toric, yeah. So she had cataract surgery with a toric implant.
Okay.
Yes, you can wear a contact. You can wear a toric contact.
Okay.
Or a regular contact.
Okay. And another question from Tish. She's first of all, what is a floater? Because she's asking about floaters. It's not related to contact lenses, but she's like, is there anything that can make floaters go away? So I don't help people understand what a floater is, and then what to make them go away.
So I would say, floaters are more common as you get older. So it's just one of the natural part of the eye aging. So there's a jelly substance on the inside of the eye called the vitreous. Over time, it dries out and starts to stick to itself and clump. And so you can get floaters that way. And then there's something called a posterior vitreous attachment, which is the vitreous again is pulling and collapsing on itself, and you can get this natural floater. So the vast majority of people who have floaters, if they just don't pay attention to them, they go away. Okay. There are treatments for floaters where we can use lasers to break them up. So if it's really bothering you, we can do a laser treatment called a vitreolysis, and we can minimize those floaters. Now, the only other thing to be aware of is that if you get a new floater, sometimes that can be a sign of something more serious, maybe a retinal tear, maybe a retinal detachment. So in those cases, when you initially get a floater, just make sure your eye doctor takes a good look at the retina, make sure there's nothing else going on, and that is just one of these age-related floaters, and then we can kind of decide what to do with management at that point.
Fantastic. So here's a question. We know that Black population disproportionately has experiences glaucoma. If somebody gets diagnosed with glaucoma, can they still wear their contact lenses through glaucoma, or is that something that they should take those contacts out and start going back to glasses and other treatments while they're getting treated for glaucoma?
That's a pretty good question. I would say if the patient has been diagnosed with glaucoma, but they're only utilizing eye drops to help control their pressures or slow the progression of their glaucoma, then yes, they can still wear contacts. Um, you know, Also being mindful that the patient should be able to put their drops in before and after they have their contacts on. So they don't want to be putting their eye drop on while their contact is in. But certain drops, Dr. Coleman, you can elaborate, but like a prostaglandin, for instance, it's a nighttime drop. So as long as the patient isn't putting in their eye drop for the pressure while their contacts in, I think there would be a good candidate. It gets a little trickier if the patient has had a certain glaucoma procedure. If it is a little bit more of an advanced procedure, like a tube shunt, for instance, they may have certain limitations where their eye doctor or specialist might not want them to be in contacts. But again, I'll allow Dr. Coleman to elaborate more on that.
Yeah, so I agree with everything stated. I mean, the biggest thing is once you get the glaucoma is the priority. So as long as you're able to get the medicines, so taking the contacts out if you have to do it frequently enough, then as long as you're able to get your medication in at the appropriate time, then the contact lens wear is acceptable. Sometimes, as Dr. Kofi mentioned, right, if we do trabeculectomies, which is a glaucoma surgery that changes that clear membrane on the inside of the eye, and that can affect how the contact lens sits on the eye. Sometimes you don't want the contact rubbing on those areas because it can cause long-term problems. So if you have, probably mild to moderate glaucoma that's controlled with some eye drops, contact lens wear should be fine.
Yeah. So I have one more thing to add on, and that's that patients should not wear their contacts when they're getting their eye pressure checked, because that can affect the accuracy of how we're checking their pressures. So always remove your contacts prior to getting your pressure reading.
That's good to know. Yeah, I think sometimes, in a macro sense, when we go to the doctor's office, we don't know what's the best way to approach that situation. We just go and we're like, okay, we're in their hands, and the doctor says what they say. So these type of programs, and some of the sites. So please, guys, if you're watching, I've been dropping in links to sites from the CDC and other organizations that you could click on to get more information about wearing contact lenses. I'm about to put the link into the Prevent Blindness link that talked about wearing contact lenses. So there's a host of information and resources out there available to you. We're doing this program to kind of jumpstart that. You can ask your questions, and there have been some fantastically specific questions asked tonight. So we definitely appreciate the detail that you're asking for, but also make sure that what's also most important is following up, right? So follow up, getting more information, following up, particularly with your healthcare provider, your primary eye care provider, because right now, Dr. Kofi, Dr. Coleman are giving some great kind of general advice, but this should not supplant the advice that you're getting from the doctor that you're seeing on a regular basis. So we want to make sure that that is clear. So you don't say, well, Dr. Coleman said, no, Dr. Coleman did say that, but Dr. Coleman didn't see you. He didn't treat you. He didn't get a chance to examine you. So he doesn't know the full extent of your specific situation. So please, again, this is a kind of a general information, but have that conversation and then take what you're hearing today, and then you can go have that conversation with your primary eye care specialist, and then they can kind of advise you on what going forward, because they can do the exam and give you more specific kind of information that's tailored for you and your situation. So wanted to kind of get that disclaimer out there, so y'all will be trying to run up on Dr. Coleman, Dr. Kofi. So like, you said, no, that's not what I said. Okay. So as we're getting close, so I'm going to ask one more time for any additional questions that you might have, please. Somebody, okay, I just missed this question. Can you explain the lens choices for cataracts?
So with cataract surgery, that's a in the eye procedure, not like contacts that go on the eye. So at the time of cataract surgery, what we do is we take out your natural lens and then we put in an artificial implant. Just for short purposes, we explain cataract surgery to people. Imagine an orange, make a circular opening to the skin of the orange, suck the orange out, you leave the orange peel behind. That's what holds your implant. So what are the options for implants? So we have our standard implants, which just basically correct distance, right? So we can set you at one spot and then that's where you're in focus. We call that a monofocal. We have implants that also correct astigmatism. We call those torics. And then we have implants that give you range. So that range can be either a multifocal, and it can be a trifocal where you can see distance, intermediate, and up close, or what they call an extended depth of focus. But again, similar thing, it'll give you distance, intermediate, and up close. So the big piles are astigmatism correction, we call it toric, range, which allows you to see distance and up close. Those are multifocals or extended depth of focus. And then we have our traditional monofocals. Those are kind of the big three buckets.
Oh, okay. So I'm still learning. Like, I don't know how many eye programs we've done this year, and I'm still learning. This is fantastic, fantastic information about contact lenses. And so as we're getting close to the end of this hour, I'm going to reiterate a few things that we said throughout this to kind of really kind of send home the point. Number one, if you don't remember anything else from this program, remember the 3 S's that you should not be doing in your contact lenses. So the 3 S's are where you start. Don't sleep, don't swim, and don't shower in your contact lenses. If you could start with those 3, if you can move those 3 out, you're on the right path to having a successful existence with contact lenses. And then it kind of progresses from there. And there's a number of, make sure that they're fitted properly. Make sure that you're not using hand sanitizer and then touching your contact lenses, because that can introduce alcohol. So there's some things that are coming into play in terms of your contact lenses. Again, always, we're going to reiterate, have a conversation, get an annual eye exam. Dr. Kofi said, hey, your prescription is good for 1 year from the date is written. Okay. So let's not try to extend it out. Our vision might change over time. So you need to see get that eye exam every year, because it can get better or worse. And we all know cataracts, as we age, cataracts start building up. They can start building up and our vision can change. And so therefore, make sure you're getting an annual eye exam. If you haven't gotten an eye exam, go get one, right? Let's not leave it up to that annual physical or the eye chart where you cover one eye and reading a line and call that your eye exam. No, go get a full, thorough eye exam so you can really see, get a handle on what your vision is like. So that's just what I've gotten from the program that I could walk away with. And I don't even wear contacts, but I know I'm about to go downstairs and tell my wife, hey, are you sleeping in your contacts? So I had to have that real conversation with her about what she's doing with her contacts. So as we're wrapping up here, any final thoughts, any things that you want to leave? I know I just did a recap, a subtle recap But are some final thoughts that you want to leave our audience with regards to contact lenses and the wearing of contact lenses? Dr. Kofi, we'll start with you.
Yeah, so you hit the three S's spot on. But in addition to that, I just want all patients out there to know that there are ample solutions with contacts, and where you're nearsighted, farsighted, you're hitting the age where you're starting to look for those reading glasses. We can still find ample solutions to make sure that it matches your lifestyle, your needs. And another thing I want patients to keep in mind, especially with the upcoming Halloween holiday, is that there are cosmetic lenses out there, right? So there's patients that can buy cosmetic contacts at gas stations or beauty supply stores, right? But a key note about that is those lenses 9 times out of 10 are not FDA approved. You want your cosmetic lenses to be FDA approved, because that means those lenses have been well studied and documented, and they know that they're not going to have harmful effects to the eyes. There's really no quality control for those lenses that are found at certain like retail shops and beauty supply stores. So your local eye doctor will be able to hook you up with lenses that are FDA approved, that also have the cosmetic benefit where you want brown eyes or blue eyes or green eyes, etc. They even have like theatrical lenses, that they could hook you up with. So, I just want patients to be safe and know that they can have a fun and enjoyable experience with their lenses.
Absolutely. Dr. Coleman.
So I want to say that your doctor is here for you. So, as Dr. Kofi mentioned, contact lenses are a solution to vision correction problems. But also, if your contact's not fitting correctly, if the eye is irritated, then you want to just reach out to your doctor. We want you guys to get routine eye care. So there are lots of things you can find out by looking into the eye. Some of it's general health, diabetes, glaucoma, which is more prevalent in African Americans, which is asymptomatic, right? Don't be afraid to go to the eye doctor. We're friendly. We don't give shots. All we do is look. So reach out for your doctors. We're here for you.
Absolutely. Well, that is great information. It's been a fantastic program. We're going to re-air this tomorrow morning. So again, like I said at the top of the program, tag a friend, share it. I've seen some people have been tagging their friends and family. Thank you for doing that. We want this information to get out to as many people as possible, because it's vitally important. Remember, you only have one set of eyes, right? And so we have to protect our vision. We know how important our eyes are, whether we're for our jobs, whether we're working, driving. Our eyes they're the window to the soul, as the cliche says. And so we also know how disruptive it would be to our lives if we had diminished or no vision at all. And so we have to do what we can to take care of our vision, take care of our eyes, even in the situation where we have contacts, where we're introducing another element to the eyes. And so let's make sure that it's a great invention, there's a great innovation for cosmetic reasons, and we just put that lens on our eyes, but we have to take care of them, and we have to take care of our eyes. So please do that. Make your appointments. If you haven't had one in a while, make an appointment to get your eyes checked and get your annual eye exam, especially as we get older. So I want to thank everybody for joining us tonight. Tish, you've been fantastic. Jules, Agnes, Ted, and everybody else, Lynn, everybody else that's been there with us is leaving the comments. And those of you that didn't even leave comments but watched anyway, thank you for joining us. And we will see you next time here on blackdoctor.org.